Good morning. It is 9 o'clock and I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make a public comment?
Good morning, Steve Rockman from Grand Haven Township. My comments about Momentum Center. It's funded through the CMH. The center's model is radical inclusivity. As a taxpayer, I don't believe I should be paying for radical inclusivity. The Momentum Center Town Hall on Racism and Education System is an example of its radical inclusivity. The following are quotes taken from the town hall, moderated by its experimenter, Barbara Lee Van Horsen. Maybe this is Barbara Lee's idea of a stigma-free environment for community conversations, embracing the inherent worth of each individual. Barbara Lee started the conversation. Our town hall is on racism and the educational system and presented by the Anti-Racism Task Force from Ottawa County and made up of about 35 different organizations. One of those is the CMH. Our panelists tonight, I am super excited. Calvin Terrell, the Social Centric Institute. Becky Bush is the OEIFC curriculum consultant. Calvin Terrell began. We have the land of the free and the land of the thieves and the home of the slaves. Do you know what we do in school? We indoctrinate children to sustain white wealth. Schooling is about indoctrinating people to sustain white wealth. We've been a society of law and order, and that order is about sustaining white dominance. How do we exploit these crises that we are in right now? As an opportunity to reimagine schooling. If you have a paperwork, draw a ladder with 6 rungs on it. Top rung, white people. Second rung, white status. Otherness, dangerous. Black status, black people. This is the order. It's been legalized since the inception of this country. Only education, true education, will interrupt us. And then Becky Bush commented, Calvin has done an amazing job already of providing us a broad view of the issues we will be discussing tonight. Fortunately, the past cycle of an effective American history instruction can be broken. And Barbara Lee followed up. Thank you so much, Calvin and Becky. Incredible presentations. Now, Calvin Terrell suggested a strategy. I think the first thing is to do is look at who is in the district, the various identities, starting with race, looking within each racial identity, gender expression, class, religion, belief, cognitive abilities, sexuality. Every group is dealing with these issues. Intersectionality, it sounds like. This is not a stigma-free environment. It was a struggle session or a denunciation rally. The only thing missing was surrounding a kneeling victim with raised fists and shouting accusations, perhaps at a new location. This was radical inclusivity, a so-called grassroots community conversation. The left cries systemic racism. Well, this is it. The taxpayer should not be funding systematic bigotry. You can stop the funding to the Momentum Center and reevaluate the funding to the CMH. In the words of Calvin Terrell, interrupt this. God bless you. Morning.
Thank you. Would anyone else like to speak? Okay, so next we have approval of the agenda. Is there a motion to approve the agenda?
I'll motion to approve the agenda.
Second.
So it's been moved and seconded to approve the agenda. Is there any discussion? Seeing none, all in favor of approving the agenda, please say aye.
Aye.
All opposed, say nay. The agenda is approved. Moving on to consent resolutions, we have one item under our consent resolutions, which is approval of the proposed minutes from the April 18, 2023 Health and Human Services Committee meeting. Is there a motion to approve the consent resolution?
So moved.
Second. Okay, is there any discussion? Seeing none, all those in favor of approving the consent resolutions, please say aye.
Aye.
All opposed, say no. The consent item is approved. As we have no action items for this meeting, that moves us to our committee reports, where we will receive updates from several departments. So we will begin with Community and Mental Health, Lynn Doyle.
Good morning.
Good morning.
I'll give you a couple updates on CMH. We continue to be busy. Although those first couple of weeks after school lets out, typically for us, slows down as far as referrals for kids. I think there's some breathing of fresh air and maybe calmness that happens right after school gets out. It typically picks right back up for us, but we welcome that slowdown. As I've said in the past, requests for children's services continue to be our highest demand at CMH right now. I wanted to give you an update on our new Children's Mobile Crisis Response Team. I think the last meeting I was at, I gave you a little bit of information about that. Our soft launch is planned for mid-July. We're currently training our on-call staff for that program. Our plan is to inform people about this program when it's up and running, even prior to that. Planning on posting on our webpage, our social media, and also distributing information regarding the program to stakeholders and community partners, including schools, law enforcement, other community providers. This program will work in conjunction with our community crisis intervention team, CIT. CIT will cover 8 to 5, and then the Children's Mobile Crisis Response Team will start working from 5 until midnight. And I will keep informing you and our CMH board as that program moves along and is up and running. I also wanted to give you a little bit of an update on a recent grant that we accepted. The grant was called Boundary Spanners. We've actually changed the team's name to Deflection, Diversion, and Reentry, so DDR team. It actually, for us, makes a little bit more sense than Boundary Spanners. This grant, if you recall, I talked about it at a previous meeting. The goal of the program is to provide services to frequent utilizers of multiple systems. Those systems could be within the law enforcement, within courts, jail, the emergency department, mental health services. The plan with that team is to help stabilize the individuals that are those kind of frequent users of programs. The hope is to provide intensive, individualized, and prolonged support to those folks with the outcome of improved outcomes. So what ends up happening is there's a smaller group of people who end up using a whole lot of community resources. And we believe that by providing that intensive case management kind of activity, we'll be able to get them connected to the right services, be that housing, treatment, and hopefully reduce the number of visits to EDs and other community resources. We continue to struggle to fill some positions. I had a meeting recently with HR and John, and we discussed some ideas, and the plan is to put a proposal together for John, and obviously if we're asking for any changes with wages or incentives, that would have to be discussed at the board level as well. So planning on working on a proposal for that. The last thing I wanted to leave you with is we recently hired a new deputy director. Her name's Anna Bednarek. She's was previously our program supervisor for integrated care and community development. She's been with us for many years. And we're excited. She's going to be a great addition and help to me as deputy director. So unless people have questions, that's all I have for you today.
You just brought up that you had asked John for additional incentives or?
Just right now we're talking about proposals to try to help recruit certain staff that we're struggling to fill. We have again, it's primarily those master's level clinicians that we're just struggling to fill those positions. We've had a vacancy on one of our teams for over 4 months. So
would these be managerial level?
No, these are staff who are providing direct service.
Aren't we kind of in process right now for kind of looking at a union?
Yes, there's been one already. I'm not
So we
completely up to
probably-
date on the
we probably
details of
wouldn't
that.
Want to look at negotiating any kind of increases, correct?
Yeah, that would
Could be
definitely have to be
misconstrued,
part of it.
yeah, Could be
Mhm.
misconstrued.
Mhm.
Okay. Yeah, just something to consider.
Yep.
Right now might not be the best time for that, even though we want to be helpful. But we want to make sure we stay within the confines of, kind of what's going on with the contract process.
Right.
There's another question. Thank you.
Yep. Mr. Mima.
Good morning. Can you tell me, what was the name again that you changed it to DDR? What was the name for the new grant? I forgot I got
That's
the
right. I forgot
acronym,
it as
but
well. So it was Boundary Spanners. That was actually the name of the grant that we secured.
Mhm.
And the new team is called Deflection, Diversion and Reentry Team.
deflection, diversion, and reentry.
Yes.
Okay. And then Lynn, would you be willing to just share what are some different examples of what that might look like? I'm just wondering, that intensive individual support. Can you give some examples of what that might look like, of the good work that will take place?
Yeah, so it could be that those individuals are frequenting services because perhaps their mental health treatment isn't solid, or their substance use disorder treatment isn't well planned out for them. And sometimes it's a matter of they don't have transportation to get to the meetings, or they're just, they need some help getting linked to services. So part of what this program will do is kind of walk side by side with that individual to make sure that those supports and services are in place. I mean, if it's someone who goes to the emergency room frequently, and of course, if they need that mental or that health treatment, that's fine. But a lot of times there are folks who will go to the ED for things that probably could be handled better in the community. So it might be a mental health treatment issue. So the hope is to get them connected to resources and supports that they need in the community that they're struggling to get on their own.
Thank you.
Mhm.
Commissioner Ebo.
Just to kind of piggyback on her question, can you give us, I don't know whether you can answer this, but can you tell us more or less how many clients, patients, residents that you have right now that it would maybe help? Is it 10, 15,
In
25?
that program.
Yeah,
we
in
were
that
just talking
program.
about.
Yeah, just kind of give us an estimate of
Sure.
how many.
Yep. So right now, as of 2 weeks ago, the team is just getting started with grant dollars, but 2 weeks ago, they had already opened 6 people. The goal eventually, so it will be a rolling kind of caseload, but they're hoping to have 50 or 60 on their caseload with a goal of 200 for a year.
Commissioner Husky.
During our last CMH committee meeting, I did a board meeting. I asked about how many AFCs we had here in Ottawa County that we were supporting. Do you, and you said you would look into it, and I know I'm putting you on the spot here. I just
Mhm.
wondered if you had had an opportunity. You're very good usually at following up with that kind of information.
And I apologize that I didn't follow up
Oh,
on
that's okay.
that.
You're usually really, really good about it. So I didn't know if you had had a chance or.
Yeah, I'll have to get back to you on the exact number. So we have there are various types of adult foster care homes in
Yeah.
Ottawa County.
Tier 1, tier 2, tier 3, correct?
No. So the differentiation that we use is specialized residential or non. Specialized residential means that we are providing some Medicaid dollars to help support those individuals who live in the homes.
Oh.
Regular AFCs, adult foster care homes, we don't provide additional support to. We don't contract with all of the adult foster care homes in Ottawa County. There are homes that serve seniors and the elderly and other individuals that aren't our consumers.
Sure.
So there are many AFC homes in Ottawa County that if they're licensed, it actually goes through Laura at the department.
Mhm.
So were you looking at,
Specifically
of them?
those, no, just the
Okay.
ones that
Oh,
actually
okay.
CMH actually supports.
I can get you the exact number.
Maybe, is it Monday? I think we meet.
Yes.
Yeah, if I could get
Mhm.
that information, that'd be great. And would you let me know too, CCBHC services, if they're offered at those AFCs as well? So,
If the individuals are consumers of ours, then, and they have a severe mental illness or substance use disorder, then they would qualify for CCBHC services.
Okay. Thank you.
Yep.
Any other questions? All right, thank you.
Mhm.
Okay, next we have Jennifer Brzezowski from the Community Action Agency.
Good morning.
Good morning.
Some updates for us. I know it seems kind of strange to think about this right now, but Walk for Warmth. We're trying to do some planning more upfront so that there's not this big rush. And the 2024 Walk for Warmth will be on Friday, March 8th. So we're going to do it a little bit differently than we have in years past. And we are looking at doing around sunset. So kind of more of an evening walk. We're hoping that we'll gather more individuals and families that can come out that might be busy on Saturday mornings with sports. We are also looking at rebranding. So we recently received approval from administration on changing our name to OCA. So really not a name change necessarily, but just shortening down to our acronym, which is Ottawa County Community Action Agency. So just shortening that with the goal of differentiating ourselves from Community Action House. There's a lot of confusion in the community with that. So along with that, one of the things we'll be working on is branding with a new logo. And what we're thinking about doing is working with local college students and maybe a graphic design class, making it a project so that they can come up with a new design for us that we can choose. That's definitely more cost effective, and it also involves the community, which we're huge on. We will also, since the new position was approved, and thank you for that, our grant and development coordinator will be looking at trying to onboard some interns to oversee. And those interns will do various number of projects. We're looking at like customer satisfaction surveys, doing help with our Walk for Warmth, exploring different grant opportunities. So we're looking forward to getting that started. She'll start her position on Monday. Our weatherization program is going very well. We're almost at our goal for the year for the Department of Energy grant. The goal is 29 houses to be weatherized, and we're very, very close to that. So we're excited that we've had a lot of movement in that program. We've onboarded several contractors. We've had a lot of interested clients. So we've had a lot of success in the last year on that program. We are 3 of us staff members, myself and 2 other staff members will be attending the Michigan Community Action Summer Conference at the end of July. There's a lot of great training opportunities, and it's for all community action agencies in Michigan. So it's a great networking opportunity so that we can find other supports in the area, and also have a lot of professional development opportunities there as well. And lastly, but certainly not least, in case any of you follow our social media, we had a post about one of our, I may have mentioned this last time, but I just want to give her another shout out. Our volunteer of the year was honored in Lansing in I believe it was May. Her name is Kim Blaker. She's an amazing volunteer for our senior food program. She was somebody that was delivering food boxes to one individual and noticed that they were having some major health concerns. So she went above and beyond to help this client more than what her role was. So we nominated her for Volunteer of the Year for Michigan Community Action, and she won that award and was honored in Lansing. So we're really excited about that, and just really appreciate all the community members that really help us drive our programming. So any questions?
Commissioner Minema.
No questions, but just congratulations to your
Thank you.
employee, with your volunteer with Kim, and sounds like you're doing a lot of thinking ahead for different things and being proactive, and I hope that's a great time for you guys with the PD and gaining some new insights and
Mhm.
sharing with one another. I know that's how I always learned the most in my teaching, is you would go watch
Yes.
other teachers and you take home the best of the best. And
Right.
sometimes it's a nice reminder too, like, oh, we're doing that. That's good work,
Mhm.
right? So I hope it goes well for you.
Yes, thank you. Appreciate that.
No
Commissioner
questions
Kennedy.
either. I just wanted to say thank you very much for providing an update on your new position as a grant coordinator,
Yes.
correct? And like what her
Yes.
plan is. So
Yes.
Really appreciate that and look forward
Yeah.
to hearing more
Yeah,
about her outcomes.
very excited about it.
I
She's
bet.
a great staff member.
Commissioner Belknap?
Hi.
Jennifer, can you repeat again the date proposed for the Walk for Warmth?
Yes, Friday, March 8th. And around that time of year, sunset is around 6 PM, we think. So we're kind of shooting for that time frame. And it'll be at EV Construction again on 6th Street. I'm hearing there's construction there on that road, so we're hoping that it's wrapped up by then. So it's a great location, though.
Okay, any other questions?
I had a
Amazing.
great time at the last Walk for Warmth, and
Great.
I know we're doing it in Holland again, but I just want to put my little thing in for Zealand because we're getting brand new. I know. I'm just going to put this out there,
Yes.
for the next year, we have brand new heated sidewalks that are going in. It's
Yes.
going to be wonderful. So we'd love to
Yes.
host you again in the future.
Okay, I appreciate that.
You
Thank
bet. Holland is beautiful, though. We can do it
Yeah.
another year in Holland for sure.
Yeah, Window on the Waterfront is a fantastic location too. So
It's gorgeous.
Yeah.
Yeah.
Yeah. thank you.
Heated sidewalks do sound pretty amazing, though.
Yes, for sure.
Hey, any other questions? All right, thank you.
Thank you.
All right, and next up, we have Adeline Hambley from the Public Health Department.
Hi. Well, morning.
Good morning. Good morning.
Excuse me, sorry, I can put these. I'm a paper person, and so I didn't, these aren't in the packet, but audience. I don't know, it's like office supplies. I got new pens yesterday and I'm like so excited to write stuff today.
Where do all the pens go?
I feel you.
I guess
I had a colleague that.
I feel you, Adeline.
I have to bring printouts just for the other people that need to have something in their hand. So for a brief update, we are mainly concentrating on accreditation. The state's coming for accreditation in July. We were originally scheduled for the spring of 2020, and so everything got put on hold. So this accreditation cycle is a little strange. It's usually 3 years, but they'll be looking at what they were going to in 2020, which is 2018, 19, and 20. And then they'll look at 21 and 22 when they come. I shared previously with the committee the plan of organization. And I believe I heard yesterday that Jax and Elena are reviewing that, I think. Lisa wanted a Word document, so I believe they're working on that. So hopefully it'll get to Chairman Moss soon. I will come back and I may have a brief update at the July meeting, but probably the full update on accreditation for August, because I believe they come after this committee meets in July. So, but today I will focus on all things teeth. So we have a couple of grants that will be flowing through. And so I wanted to just provide a general overview of the programs related to it. And so I apologize firsthand that we don't have any of our hygienists. Everybody's on vacation or college visits or something this week. So I won't be able to speak quite as expertly as our hygienist would. But our oral health services program, I put the goals down there. It's to increase access for school-based oral health disease prevention program for dentally at-risk children, reduce dental disease for children that are provided dental services on the Miles of Smiles mobile unit, which is pretty recognizable for folks in Ottawa County, the big, huge bus that has Miles of Smiles on the side. We provide Ottawa elementary schools and Head Start centers with oral health education and resources and increase access to care for at-risk adults in Ottawa County. And so some of the numbers from the 21-22 school year, 3,725 students received classroom education on oral health in the sealant program, and 751 preventative and restorative dental appointments on the Miles of Smiles mobile unit. On the back is a picture of the bus that is new. We just got it in the last year, I believe, changing out the old one. And so it's pretty spectacular how like specialized it is inside. And so it does have a waiting area, a lab, 2 dental chairs, a dental x-ray, and a wheelchair lift. So they primarily focus, on preventative and restorative dental services for low-income children at schools, Head Start centers, health department clinics, migrant summer schools, and other sites for underserved. There's a list of kind of where they focus, and all the dentists that work and help on that Miles of Smiles volunteer their time to do so. So we're really appreciative of that partnership and their willingness to donate their time. Seal, Michigan is a school-based program, and our hygienists use portable equipment in the schools and go right into the schools to provide the sealant, which is like a plastic coating to help prevent decay. So there's a number at the bottom and our web address, myottawa.org/dental, if anybody wants more information or to sign up. This next page is, I just wanted to make sure it was clear, not just teeth, it's all over health and how much that can impact your other parts, or even be an indicator for other health conditions. And so the mouth connection, mouth body connection, that overview, that I think is interesting, that pregnancy expectant moms with periodontal disease are more likely to have preterm births. Osteoporosis, gum disease cause bone loss that can lead to tooth loss. And women with periodontal disease have higher rates of breast cancer. And then, other overall effects are kind of listed there. I don't want to read them all to you. Specifically, a couple of grants that will kind of flow through for you to consider is Delta Dental Foundation. They support and provides funding for the Miles of Smiles. So what I provided is just the first page of the grant. That's not the full grant, just so you'd recognize it when it flows through. So they awarded $10,000 for Miles of Smiles. And what that will go to, we originally applied for and asked for $15,000, and to provide an estimated 42 uninsured Ottawa County residents with approximately 73 appointments for dental services on Miles of Smiles. That second page in there is the brief description of what they're planning to do, and some more information on Miles of Smiles. As you can see, it's been around in Ottawa County for more than 27 years, and provides services to approximately 25 schools in Ottawa County. Now, the second part, I do have more of an expert on teeth than me. So the second grant that is going to flow through is for my community dental centers. There's an overview, and again, like the first page of the agreements, you would recognize it when it comes through. But I'm going to ask Kim to come up from my community dental center so she can just provide a brief overview for you.
Great. Good morning. Thank you for the introduction. Again, my name is Kim Singh and I'm with My Community Dental Centers. We also often refer to us as MCDC. There is a one pager. I just wanted to, thank you so much to be able to share a little bit about who we are and the services we've been providing in Ottawa County. We were established in 2006. We are a nonprofit that operates a statewide network of dental centers. We have 34 statewide. Actually, in 2022, we served people from 82 of the 83 counties in Michigan. Our centers, we refer to them as centers versus clinics, are operated in partnership with local health departments. So the 34 dental centers are in partnership with 23 of the 45 local health departments. Historically, adults enrolled in Medicaid had significant difficulty in finding a dentist. Historically, only 10% of dentists statewide participated in the Medicaid program due to very, very low reimbursement rates and maybe some other things administratively. So again, our model has been able to allow us to provide that expertise in partnership with the local health department, as you can see, is also focused on the impact of improving oral health on overall health and well-being in a community. Just some highlights. We're approaching our 5th year of operation in Ottawa County. We're located at 805 South Beacon, was formerly a Family Video. MCDC actually paid for the renovation, the equipment. We leased that to the third party at the Family Video. Hours of operation, we have 4 10-hour days, 7:30 to 5:30. It's comprehensive dental care. So full scope dental care from prevention, cleaning, exams, fillings, extractions, all the way to dentures. Again, last year, 2022, we served just over 2,300 unique individuals or unduplicated, providing just over 5,400 office visits. So our patients are scheduled. We have a schedule, but on top of that, we did see 202 same-day emergency appointments. So again, these are people that have an emergency that day that need to get into that dental center. Again, 64% of the patient base is enrolled in some form of Medicaid. So it might be the Healthy Michigan Plan, previously traditional adults, or a small number, but we do see a small number of children that are on the Healthy Kids Dental. 24% of that population has some form of traditional. So one of the things, maybe going a little quickly today, but we focus on dental care for all. Our focus is the underserved, but we really want to make sure everyone has an opportunity for a dental home and regular dental visits. We also have a sliding fee scale based on household income, so reduced rates. And we also have a reduced fee schedule for our veterans. So again, we really want to make sure we have a focus for veterans. Again, the partnership with Ottawa County Health Department has been, I think, a win-win in terms of expanding access to care, shared vision, again, of ensuring access to quality dental care. We're able to provide the expertise of dentistry, successful track record, and the financial support for the dental center. Health Department, again, provides that community education, outreach, advocacy. Again, there is no financial commitment from the county or the health department to operate this. Again, the partnership has positively impacted residents, and we're asking that you approve and enter into a new 5-year contract extension that would reaffirm the partnership and continue to enable us to provide quality dental care to the residents. I also have our annual report that I've distributed 2022. There's a QR code to an online version with some video message from our CEO, who is also a general dentist, former Army vet. And again, we'll welcome any questions.
Any questions?
Statements. Oh, go ahead. You go first.
Mr. Minima.
Morning, Adeline, and morning, Kim. So I had always great experience with Miles of Smiles, just saying as a Great Start preschool teacher. And at that point, when I was teaching Great Start, Miles of Smiles was always an opt-in only, and parents could be present. Is that still the philosophy behind Miles of Smiles?
Yeah, they send out the information through the schools to send home to parents to get the information. But yeah, it's opt-in. Parents have to provide their permission. You
Yeah.
can't just go on there. So
Right. I know many parents were very pleased with Miles of Smiles and we're very thankful that it came right to the school. It was something that I personally saw great success with. So just wanted to put that out there. But yeah, I had those questions. Just wanted to make sure that was
Yeah.
still
yeah,
opt-in and
and the kids, it's kind of exciting too because it's like it's different, right? To get on a bus for
yeah, it was pretty exciting for
Yeah.
them.
So it's kind of, I mean, normally there's a lot of anxiety or fear, especially for some of the kids that may have never seen
Mhm.
a dentist.
That was my
before.
experience too. I thought that they would be. And as
Mhm.
soon as they saw, they're like, I get to go on a bus,
Yeah.
you know? So they were pretty excited about it. And usually I'd be like, I think I should stay. And they're like, this is great, Mrs. Meadmore.
Yeah.
So yeah, it was good. Mr. Cosby.
Yes. So I'm so excited about having the opportunity to discuss oral care in Ottawa County. When Lucy and I were at League of Women Voters, when we were campaigning, for whatever reason, there was a rumor out there that we were going to get rid of Miles of Smiles or Miles for Smiles. I'm like, absolutely not. I'm an ER nurse and I've worked in multiple communities, multiple states. And there's no sicker patient oftentimes with somebody with a dental abscess. And when you only can offer antibiotics and pain control because you have inadequate dental services, it's really, I mean, it makes me want to pull money out of my own pocket to make sure that they're cared for adequately. So, I mean, Michigan should really be proud for the services that they're able to provide. Definitely. So I want to thank you very much for the services here, dental services here in the community.
Commissioner Evil.
Yes, I just want to echo everything that's been said here. I totally agree with that. Dental services is very important, you know, for families that can't afford it. So thank you so much.
Hey, Mr. Curran.
This question is for Kim. So I noticed that basically it stated that many adults who have Medicaid, only 10% of dentists accept Medicaid. Is that the same for children with Medicaid or is it different?
It's
for
different and
kids?
we're actually hoping that it changes for adults as well. For
Okay.
children have had since probably mid 2000 or several years now, over 10 or 15, the kids enrolled in Medicaid received a Delta Dental or a Blue Cross card. So they received Healthy Kids Dental. So it was transparent to Medicaid. So providers were paid a higher rate, closer to commercial rates. So children have had much better access.
Okay, thank you. And thank you for these programs. This is teeth and feet. That's what our family always says. That's where we
And I-
focus.
And I just want to thank you all and your leadership because Ottawa County truly has been a pioneer and a leader statewide in oral health. So thank you.
Yeah, so important.
Mr. Bottom.
Yeah, thank you. I've heard from folks that are on Medicaid when they're trying to identify providers that accept Medicaid, that it's difficult even online to search a list that would, show them providers in their local area. Is that available on your website, or can you point folks to a place where they can find current providers for oral care that are in their area?
So our website likely is going to focus on our 34 centers. Again, we do have referrals and if they get to a center or we have actually centralized patient registration can help them. But I know that the Delta Dental Foundation does have an active list of dentists accepting Medicaid, and also effective January 1, there was a rate increase for Medicaid dental. So for all adults and children, the rates are now average commercial. So again, statewide, we're optimistic that we'll see more dentists begin to accept Medicaid. And also those adults, instead of the state managing their care, the majority are going to be administered through health plans similar to their medical care. That was a recent change.
So do you believe if we went to the Delta Dental webpage, we'd find the foundation link on there and maybe?
I will follow up. I will commit to following up and providing that information back to you in terms of what is the best website. I would think perhaps directly to the foundation. I'm not sure, but I will commit to follow up.
You're kind. Thank you.
Thank you.
Thank
Just
you.
quick-
Any other questions?
211, will they have your resources?
Yes, they do.
available? So
Yes,
that's
they do.
something that you could use, Commissioner Bonema, if you have if one of your constituents has a question.
It's called 2-1.
You just dial 211.
Oh, 211. Oh, yeah,
211.
information.
Yep. Yeah. And then another thing, because I attended a brown bag, when was that, John, Friday? Or Thursday or Friday last week, and the dental hygienist from the health department thought that we had refused a grant. And we haven't, it hadn't come forward, so just want to make sure that that information
Has to come through. I think, and I need to touch base maybe with legal, that the MCDC contract had, I don't know, probably, I think it was something technical, so I need to follow up.
Yeah, it hasn't come forward for a vote. So if you could
Yeah.
share that information, really nice young lady that was there. I can describe her, but I didn't catch her name. So
Yeah.
appreciate that. Thank you.
If you hear me to respond,
Sure.
as far as the Delta Dental Agreement, we did reject it only on a very technical basis.
Mhm.
Nothing about the contract itself, but the indemnification clause just needed to be corrected.
Yeah.
And and I think we made that very
Yep.
clear.
Yep.
And the other one was the non-discrimination clause. So we made that, we gave them notice as far as that is concerned, and we're just waiting for them to resubmit it to us, and then we'll pass it on.
So usually I think both would go through ratification
Yes.
process. So I think just Chairman Moss will see it, and then it will be on like a consent agenda part. But I wanted to start as we learn, and I meet with John and figure out the best way to get information to you, whether it's going through the ratification or through the finance and, the committee and then the board. I think it's beneficial to take this time to provide some additional background, education, answer questions. So it's not just reading the words on the page. We can answer questions or see what concerns might be and just provide information. So I thought, since I know these two are coming through, and that we should talk about teeth, I guess.
Yes, the word rejected was the issue, and rejected doesn't mean, is it on board? I'm trying to remember the name of the software program.
On base.
On base,
It's
on
on
base.
base.
And it's
It
just-
was on base, and it wasn't rejected. We just needed some modifications done.
Yeah.
So the contract itself or the grant is good. It's not a matter of, we're saying no.
Exactly. So maybe some limitations in the words, the verbiage in the program.
Yeah.
Yeah, and how that system, like how it works, there's not once it's out, and then it gets resubmitted. So there's not like it stays in and then you modify it in there and it keeps going. So maybe that's where some of that came from. Was that?
So just a quick question. I'm kind of confused where we are with the contract.
Commissioner
Is it-
Zylstra.
Sorry,
Okay, go ahead.
I did my hand up. I'm sorry. Where are we with the contract?
Well,
I mean, is it ready for ratification? I'm kind of confused. Sorry.
I believe there were some changes for Delta Dental requested in the contract language that needs to be done and then resubmitted in the
Okay.
ratification process. The MCDC one, I'm not sure on because I didn't specifically I need to touch base.
that
that
one
one.
had to do with a signature. And it was not us, but it was the board itself. So it's not in our queue. But as far as the other Delta Dental that we sent back on June 14th.
Mhm.
And I would expect that Adeline is going to return it to us. And then as soon as we get it, we'll then put it back in the ratification mode and it'll be off to you.
So I don't know for the MCDC, did that get to you, Chairman Moss, or?
I'm not sure, but I can
Okay.
check.
Okay.
Yeah.
Otherwise, yeah, if you could let me know, I can resubmit it, or if you prefer it to go through the committee to the board, we can do that too.
So.
Well, I appreciate you bringing these forward to us. The transparency on it is great. More information is great. So that's been good. So are there any other questions on the dental? No. Okay. And then are there any other questions in general?
Yep. Adeline, this is for you, as the health director at the moment. Just some questions on a different topic, things that are coming from constituents, concerns I have. It is concerning the Grand Haven Pride Festival that the Ottawa County Department of Public Health was there. And so I do have some questions for you on that. I'm wondering how much money was spent to have a booth there. That's my first question. And how was this paid? Who knew about the payment and was involved in that decision? Those are my starting questions.
I have to double check if there's anything that was paid to have a booth there, but we have a booth there to provide health services for targeting the most at risk. We had provided Mpox vaccination and as well as COVID. And then we provided STI prevention education at the Pride Festival. We have to kind of meet people where they are. So that's where we were there. And but I don't know if there was money spent for the booth. I have to double check that.
Yeah, I would like to know how much money was spent to be there, how it was paid, who made the decision. I would like to know who accepted the sponsorship funds.
It's not a sponsor.
Okay.
If we were there as a booth, it's there to provide healthcare services at a targeted population for at risk, higher risk. So there's no sponsorship of the event. It's us there to provide targeted healthcare for a high risk group.
And then the next part, I'm just asking for listening. I'm not asking for a response at the moment. I just wonder who bears the responsibility for future actions as a result of participating. I would like to just share as a teacher with a master's in early childhood. I know that one of the main ways that young children learn is by observing the world around them and then acting out what they're observing. In a way, making sense of the world around them. And this is called pretend play. So let's imagine that a young boy or a girl experienced the drag show, who were given money to offer to the drag queen during the performance. And now let's fast forward to this fall. Imagine with me a preschool classroom, and now this young boy or girl offers pretend money to another classmate, suggesting they perform such as the drag queen was doing. Is this promoting healthy behavior? Many school handbooks have discipline policies that address inappropriate behavior, including sexual behavior. So who now is responsible for this behavior that the health department did go along with? At a time in our nation's history where trust in healthcare systems are under question, I wonder why our Department of Public Health is choosing to participate in Grand Haven's Pride Festival. Health departments should care about the health of all members in their community. The Department of Public Health should be an open door to everyone, and to my knowledge, it is, so I thank you for that. However, this is not about caring about health in a community. There's a big difference from caring about health in a community and promoting an event by being a participant in what you're saying, providing a booth, such as the Grand Haven Pride Festival, where drag queens were seen receiving tips from adults and children in attendance. By being in attendance, the Ottawa County Department of Public Health is promoting sexual promiscuity, which in turn can contribute to future clients of public health who will be seeking positive STD testing along with mental health services. So on the county health department's website, the vision states healthy people. The mission is working together to assure conditions that promote and protect health. Values are listed as equity, integrity, and excellence. I believe that participating as a sponsor in this event went against what many people in our county would view as 1, healthy people, 2, promoting and protecting health, and 3, valuing integrity and excellence. Sociologist Dr. Diane Vaughn defines the normalization of deviance as the gradual process through which unacceptable practice or standards becomes acceptable. As the deviant behavior is repeated without catastrophic results, it becomes the social norm. I personally am weary in the sense that slander is happening over and over about when you stand up for things that are truly good and honorable. And instead it's being stated that if one takes a stand, that means that you hate groups of people, whether it's this topic or another. That slander is meant to silence people and normalize certain types of thinking. The fact of the matter is that adults and children are over-sexualized in this country, the state, and even our county. When will all adults join together to protect the health of its children in society, from their emotional health to mental health to physical health? Unless you think this is an attack on a certain group, I would be amiss to not share that many from both the heterosexual community as well as the lesbian and gay community are concerned. So again, I ask, when will all adults join together to protect the health and well-being of all members of society, but especially the children? So I'm not asking for a response. I'm simply asking for you to hear my voice today.
I'll ask our medical director. You can speak to our. Sure.
I just wanted to weigh in a little bit on the medical aspect of our presence there at the Pride Festival. So in public health, as well as in primary care, my job as a physician, as well as the medical director of the health department, is to meet people where they are. And as I heard someone say, not halfway to where we think they should be, right? So one of the reasons that we were at this particular event is because we knew that many of the attendees of the event are part of the community that has been disproportionately affected by MPOX. So this is a population, unfortunately, that has borne the brunt of the disease. So we had methods there to help prevent the disease, to help educate about other ways to prevent the disease, as well as to educate about other things that disproportionately affect many of the people that were in attendance there. I'm very excited actually to report that we were able to educate 400 to 500 people about ways to prevent sexually transmitted infections. We were able to provide education cards that list not only vaccines and condoms as a way to prevent sexually transmitted infections, but also behavior modification, including abstinence. And again, this is part of what we do in public health. We meet people where they are. I've used a very, very superficial illustration. You know how when you're at the grocery store and you're in the spaghetti sauce aisle and you think, oh, I got to go get the Parmesan cheese. Oh, look, it's right here next to the sauce. I don't have to go looking for it. That's kind of what we do in public health. We go where the need is so that those people don't have to go looking for it. And we also know that people in this community are often reluctant to seek out care because of stigmatization, because of anxiety, because of fear. And if we're right there for them, they don't have to go looking for that care that they need. And this is, again, part of our mission to take care of all people, meeting them where they are. So that's one of the medical reasons, as well as the philosophical reasons why we were there participating. Any other medical questions about it?
Commissioner Cosby.
Yeah, so do you know what monkeypox rates are here in Ottawa County?
We had, I believe, 6 or 7 cases over the course of the outbreak. We were able to vaccinate 7 people at the festival last week or the week before. So that's 7 people that are more protected now than they were before the event.
And what age groups were they?
18 and older.
18. And what's the efficacy rate for the?
I would have to get the percentages, but it is, again, like many vaccines, not 100% effective at preventing infection, but it is effective at reducing the severity of the disease. And again, thinking about this particular vaccine, this is a new event that happened in the US last year, right? So we are still in the process of gathering that information, learning more about it. And that's another reason why data collection is so important, because we need to measure what we treasure, right? We have to get the information before we can really make decisions going forward. But so it's still in process, if that helps.
Do we know what the side effects are of the vaccine?
Most of them are kind of local skin reaction, and that's part of how the immune system works, right? It's kind of like a boot camp. You know, when you go to Fit Body Boot Camp and you're sore the whole day, it's because your body's being trained to do what you want it to do in the future. And that's kind of how the immune system reacts. It is a skin disease. And so sometimes you will get a local skin reaction to it as the immune system is trying to figure out how to fight off the virus. But then it does reduce the severity if someone does come into contact with that infection later, so that instead of getting infection throughout the entire body, it may only be in that one location where the vaccination was given.
So nothing systemic that you're aware of?
Correct. Well, sometimes, again, like I said, it's like the immune system going to boot camp. So you may get a little bit of a low grade temperature because that's just the immune system revving up a little bit. But in terms of overall systemic side effects, again, it is much less severe than actually getting the disease itself.
Do they come in individual doses or vial doses?
They come in vials.
Vials. And so the insert, does it have the information, the pharmacological information in the insert? The COVID vials did not.
I have not read the insert of the actual package itself,
Sure.
but we do provide the vaccine information sheets that are given along with the CDC recommendations.
And who is giving the injections?
This would be our immunization team. So we had a sexual health nurse as well as one of our other immunization team who is credentialed and it's within their scope of practice to provide vaccines.
And so do we have follow-up with these 7 people that we injected?
I'll have to see if they're scheduled for
Just
their
to make sure.
second dose, but I know that our sexual health team is very, very vigilant about making sure that people are getting the follow-up that they need.
Perfect. And also with you said you provided COVID vaccinations as well,
Yes.
or injections? Okay. And so we'll be following up with them as well.
They are given all the information about, letting us know if they have any side effects or any of that information. But typically with a COVID vaccination, they're not necessarily scheduled for a follow-up appointment.
Okay. Just a recheck, see how they're doing. Okay. Thank you.
Commissioner Ebel?
Yes, can you share with us what other festivals that you have had booths at?
We're scheduled to do the same thing to provide Mpox vaccination, COVID vaccination, as well as information about general health at the Holland Pride Festival on the 24th. In terms of other festivals that we've participated in, this is my second summer here, so I don't have the whole history of that, but I know that we have participated in other events before. And again, not just Pride events. We participate at Tulip Time. We participate at other festivals where health information and health services are needed. And that's part of the, again, the way that we meet people right where they are. So that way they don't have to come looking for us in that mysterious brick building on James Street.
Ms. Hamley, are you able to answer that question?
I can say that it's a little unusual because we haven't, most of the events that we would attend would be vaccine events for COVID in the, 2021. And, but we do, this specific style booth would be very specific for an event like this. We provide a Grand Valley STI testing clinic monthly. I know we go to I'm not sure if we're at Coast Guard, but Holland, Tulip Time, any sort of community event. I think they go to the farmers markets. Now, what's at those booths, it's different. It's overall services that are available at the health department. The dental team might be there to provide information. Our sustainability team might specifically for farmers markets would attend to provide information on their composting program. So it varies on the event. I would say we do try to be out in the community to provide information on the services that are relevant to the event as much as we can.
So prior to COVID, were you attending any of the festivals, like Veterans Parades? Any of those, the
It's
Christmas
not
parades?
so much parades because we wouldn't, it's not necessarily helpful to for us to march, I guess, in the parade to provide information. It'd be more of like events where there are booths or tables set up. So it might be farmers markets, or it might be Tulip Time during their craft event or something where there's like,
Park.
yeah,
Art
right,
Park.
something where there's booths, so that we can put the information out for people, and provide information on the services that we provide. Excuse me. But not so much, yeah, marching. I don't know, I guess we could ask.
Okay, any other questions?
One more.
Mr. Bonema?
Yeah, thank you. Addie, last Tuesday, we sat down and you kind of gave me a little bit of an update of what your department has been up to and expecting to be working on over the summer in advance of this meeting. And you actually brought the Holland Pride Fest up a little bit and talked about your table there to help serve the needs of the community that were there. And you mentioned that there was an outbreak alert in Chicago, and that was something that you were trying to be proactive. Could you speak to that? And then I have one more question.
Yeah, I don't know if
Sure. So in May, there was somewhat of an emergency call involving health departments all across the nation, really, but stemming from an outbreak in Chicago, where we knew that it was coming up on summertime when people would be traveling. They were making sure that they got the word out soon, because the percentage of people that were vaccinated that had the opportunity to be vaccinated was actually pretty low. So we wanted to be proactive before people started traveling back and forth between Chicago. And then they also did a study where it looked like Wayne County was at a high risk for a potential outbreak. So because we're kind of right there between Chicago and Wayne County, and we knew that people would be traveling a lot, we knew that there would be, again, attendees at these events that are part of the population that has been the most affected by this infection. We wanted to make sure that we were ready and that we were able to help give people the tools that they needed to keep themselves safe.
Great. And then the second part, you mentioned that you were in communication with Administrator Gibbs' office prior to going to these events and making sure administration was aware of the services that you're providing to the community at these events. Is that accurate?
yes, yep.
Okay.
And we talked a lot about the outbreak, the health alert that we received from neighboring or from Chicago regarding increasing rates and the need to be there to provide preventative services and education.
Okay. I just wanted to make sure that that was clear as well.
Mhm.
Thank you.
Thank you.
Administrator Gibbs?
Yes, I can address that point, and thank you for bringing that up, Commissioner Ottawa. Right now, the situation we have is that if the health department believes that it would like to participate in one of these festivals, they are doing that. And if I did not want to do that, it still would happen anyway. So that's kind of the dynamic we have right now. So yeah, if you get what I'm saying.
Any other questions?
But when we did talk about it, you said it did make sense for us to attend. So we would attend for what is makes sense for public health services for the community, but.
Yeah, my thing that I want is no headlines and no controversy with everything that's happening out in the world today. So I think that's important going forward.
Mr. Zauser?
Yeah, I guess I'm just confused as to just a conversation with the administrator. Is the implication that we shouldn't be out in the community? I guess I'm confused about that aspect of it.
Mr. Cosby?
You're
Or
addressing.
who are you asking the question to?
I don't want to, I guess through the chair, leave that open to whoever wants to answer, and no one wants to answer, that's fine too.
Okay, I think we're asking questions right now to Ms. Hambley.
Okay.
So did you want to ask her that question?
I think that she's already said that she prefers to be out in the community. There seems to be some resistance to that happening. If anybody wants to answer that question, if not, then.
Okay, since we don't ask questions of other commissioners necessarily. Any other questions? Just Mr. Cosby?
Just real quick. So you said outbreak in Chicago. What defines an outbreak?
So in this particular case, I believe there were, I want to say 11 new cases after the case numbers had been very much diminished over the course of the last few months. A definition of an outbreak kind of depends on the disease and the method of transmission, et cetera. And that would be a question for our epidemiology team, who is not here today. But in terms of the particular incident that the emergency call was called about, it was 11 cases within one area of Chicago.
Okay. And so, yeah, just, I mean, percentage of population doesn't necessarily feel like an outbreak. And you said something else that kind of concerned me, that they felt like you were notified by whom? Was it the Michigan Department of Health and Human Services, CDC?
There were several health alerts that went out. There was one from the CDC. There was one from the Michigan Department of Health and Human Services. The emergency call also involved one of the clinics in Chicago that was seeing the increase in cases, as well as some of the other federal and state partners around the country in terms of making sure that, you know, one of the what they say about public health is when it works, nothing happens, right? And so that was part of the goal was, yeah, it's only 11 cases in Chicago right now, but we want to make sure that that doesn't expand as people are traveling, people are in close contact, people are attending the same events. Let's get on this before it has a chance to get worse. And so that was the goal of that.
Risk was the other word that kind of concerned me there, because there's like a level of risk or a notification of risk. And so we're looking at 11 cases and saying our risk has increased. I mean, what's again, how do we define risk? And that feels pretty low. And I know you're not going to be able to answer that one for me, but what's the lethality of monkeypox?
We have had actually several deaths within the United States, typically in folks that have underlying health conditions such as HIV infection that's been untreated. So that's another example of why it's so important that we reach these folks where they are and make sure that we're getting them the care that they need to prevent these infections, especially in the populations that, again, have borne the highest rate of these illnesses. They deserve care just as much as everyone else, right? And so if we have the capability to meet them where they are and to provide that care for them, that's within not just our legal duty, but our ethical and moral duty as well.
Yeah, and it's the with or from, of the disease. Did you die with the disease or from the disease too? So just wanted some clarification on what qualifies as an outbreak as we go forward.
Any other questions? Commissioner Belknap?
Addie, thank you for clarifying that the health department did not sponsor this event. I think that's important for us to understand. However, I do have concerns about some of the list of sponsors that were publicized supporting the event. I'd like to echo Commissioner Miedema's comments about the all ages drag show. I just think that we're setting up situations that could be prevented. I don't know as a parent how I would feel if someone offered my child money for performing of some kind because of something they saw take place at a safe place in their community. A safe place being where we have our musical fountains. I don't know what the plan is for Holland. I would like to go on record saying I really hope we're intelligent enough not to make that an all ages event. I understand risky behavior for adults, colleges, I understand that. But ladies and gentlemen, we're inviting our kids to participate in this and sanctioning it. And if we can feel good about that, I don't know what that says, but as a parent, I can't allow that for my house. And I've had people contact me and share their concerns and their tears over what they saw. I saw the images online. I just hope that we can right that ship before Holland's event And I really hope that if people look at our public health department, our Children's Advocacy Resource Center as public trust, that we're not supporting events that we put our most innocent and naive at risk.
Mr. Miedema.
And I just want to thank you, Commissioner Belknap, for sharing that. I still would like the answers to the questions that I had asked at the beginning, because I don't think that information has been provided yet. So if it's not provided now, I would like it later to see how we were involved exactly. Because I think there is some confusion there. I think children are very precious. And I think the public image of trust is so important. And so it's not just about meeting people where we're at, like what you're talking about. It is also the trust that we owe all of our citizens in Ottawa County. And I know for many people who have reached out, there's a huge level of concern with their health department betraying their trust by participating when you see the scenes that were shown. And so I can't emphasize it enough. Our kids are very precious. So.
Thank you. Any other questions? Okay, I have a few things that I would like to say as well. I believe that the claim that this is not a sponsorship is a technicality. When we participate in something, we are sponsoring it. We've seen this pattern of denial of involvement and responsibility, not only here, but we also saw it at the Grand Valley Sex Ed Week, where we claimed that our health department did not sponsor that event, when in fact we had two staff members there manning a table near the sex toy booth. I had a number of students ask me to ensure that our health department never participated in this event again. It was very clear you were there and an active participant in it. In prior years, we actually helped to plan the inaugural event there at Grand Valley. And that event is very troubling to some of our college students, and in fact, fairly embarrassing for them that that's going down at their college. And I know from people, that we've heard from in the community, they feel the same way. So we are seeing a pattern of a lack of discernment on some of these issues, especially in particular to the grooming of our children. When we expose children to the kinds of behaviors they were exposed to at the drag show, as Mr. Miedema talked about, they're learning from what they see. They're learning sexualized behaviors. And when they're exposed to these things, it reduces their inhibitions. I know a lot of people don't like hearing the word grooming, but this truly is grooming. Having worked with sexually abused children, the kinds of behaviors that children exhibit after they've been exposed to sexualized behaviors often raise red flags with schools and with parents and lead to calls to places like the Children Advocacy Center, to CPS. So parents and families now find themselves in CPS cases. I had this happen to someone close to me recently when their child was exhibiting, questionable behaviors. It becomes a very serious thing. And we're participating in events that now are setting up children for exhibiting sexualized behaviors with their peers at school. We now have multiple children involved. We have legal systems involved. There's quite a lack of discernment going on here. And sadly, we also see this from other vendors, the Ed and Nancy Hannenberg Children's Advocacy Center, the Momentum Center, to name just a couple. We can do better. So there's a man whose public policy I greatly admire. It's Thomas Sowell. And he has said something that has really stuck with me. And I think it's really important for us to use a solid footing when we're talking about public policy and the things that we choose to do and the things that we choose not to do. And it's that there are no perfect solutions. There are only trade-offs. So I hear you that you're trying to meet the needs of a certain population. And I would argue that you can meet those needs still, but in a different way. We need to use discernment, because what has happened is that, again, going back to this statement, there are no perfect solutions. There are only trade-offs. In this case, we are trading the innocence of our children for our other goals. And I would argue that that's not the kind of trade-off that we want to make here in Ottawa County. Thank you. Anything else? Commissioner Curran.
Thank you. So I certainly understand where the health department sits on trying to meet people where they're at. And I do think that that is an admirable goal. And I've also heard what the other commissioners have shared, and I want to echo their sentiment that there's a difference between providing public health services and to me, what everybody does in their own personal space and in their bedroom, who you do is up to you, and it has nothing to do with me, and everyone is free to make their own choices. And I firmly believe that. But as the other commissioners have stated, when you bring it into a public space and you are advocating for this and bringing children around this, I think that that's harmful. And I don't think that that is appropriate or something that we should encourage. So, but I certainly understand your thought process, and I get that. But I think the children are more valuable. And I think that we need to, as Sylvia said, use discernment and wisdom here. So thank you.
Anyone else? All right, thank you. Okay, next we have Kendra Spanger from the Department of Health and Human Services.
Good morning. I first want to start off actually with responding to something that was brought up a little bit ago related to Medicaid providers. There was a question about where people can access that information. So I wanted to provide a little bit of information on that first. There is an app that's called the My Health button. It is an app that any individual that is receiving Medicaid or assistance through the department can go in and receive a wealth of information, including finding doctors near them, and dentists as well, chiropractors, almost every specialization is listed. So I would definitely highly recommend, if you've got people asking, to look at that resource, or the other resource would be for them to connect with their specific health enrolled provider. Because as mentioned, there's multiple different entities that people can have with Medicaid: Priority Health, Blue Cross, Delta. So they can also check directly with the entity in which they have and use MyChart, which I'm sure some of you probably use with your own health insurance. They can also access that as well, depending on who they're enrolled with. So those would be the two resources that I would recommend if people are asking. All right, so my updates. First, Medicaid redeterminations. When I was here a couple of months ago, informed you that we started Medicaid redeterminations as of June. And indeed we have. Here in Ottawa, we had 3,500 individuals that were eligible for redetermination just for this month alone. Our average in Ottawa between now and the 14 months that are required to have Medicaid redeterminations, we're averaging about 2,700. So June is one of our highest months with 35 as of June 11th. We had 850 that were passively renewed, and about 1,500 that we've received no responses of so far. And of course, the question that people ask is, why do you think people aren't responding? Well, a couple of different things. One, obviously these redeterminations went out to the address we had on file. That was 3 years ago for many people. And so if they didn't update their address, it may or may not have gone to where it needs to go. So we're definitely using a lot of things to get information out, robocalls, texting, saying, hey, if you didn't receive this, contact the department, so that you can be making sure that you have the information we need in order to determine your eligibility. Some of the impacts that it'll have here in Ottawa will be things such as funding for CMHs. Medicaid enrollment numbers does help to continue to fund CMHs, not their whole budget, obviously. That's Lynn's specialty, not mine. But I just know that has been an impact in the past. And obviously just reimbursement for hospitals, pharmacies, things of that nature as well. So just continuing to get the word out, saying when you're getting something in the mail from Michigan Department of Health and Human Services, especially for those that have gotten Medicaid during the last 3 years, they may not recognize that they need to be sending information in to verify. So just continuing to get the word out and so that people will respond back to us so that we can make sure that if indeed they are still eligible, that they're continuing to receive their benefits. We also saw an increase for those that do go on and use our statistics, which are available through the Green Book, is what it's called, online. We had an increase of SERs, or what's called supplemental emergency relief, which are shut off notices. Here in Holland, Holland BPW does keep people on over the winter months and not sending out shut off notices, which is a great benefit to everyone. However, if they continue to receive the services and aren't paying them, then they may get a shut off notice in April. So we did see a very large increase of that this year. So just wanted to make a note of the number of shut offs that we received. And then lastly, related to our assistance payment side is our connection with the feds related to the WIC program on women, infants, and children. And just wanted to note that as of June 1st, there was an increase in the income allowable for WIC by 8.1%. So that's definitely a positive for our community. Right now, for a family of 4, they're able to make $55,500 annually or $1,068 weekly. So just wanted to make a note that that's obviously a positive for our community to continue to provide benefits for our women, infant, and children. On our migrant side, it's definitely outreach season, as I'm sure you are aware. So we are definitely actively out in the community. One of our most what I consider important areas is assisting with our migrant children. And so we work with Ottawa Food to do some beat up and eat up sites. I would highly recommend, if you haven't gone to any of those, that you do that this summer. It's a really great opportunity to be in the community and supporting, as you guys have mentioned, our most valuable resources, the children that we serve. So just a great resource out in the community. On the child welfare side, we've been doing a lot of analysis related to prevention and reunification for kids that come into our system. And as I've mentioned before, housing is a huge barrier. And these last couple of months, we've done even some more digging into that in relation to children being reunified with their families. And housing is the #1 barrier. The affordability of housing here in Ottawa is not good for our families that are struggling. And so just continuing to have that in the forefront of things that we can do, if at all possible, here in Ottawa to provide assistance, maybe subsidies to landlords in order to maintain those that might be on a MISHDA voucher, just continuing to advocate for that so we can continue to keep families housed and stable. Foster home licensing. If you may have heard or not, some legislation changed, and as of last Friday, our foster home licensing rules did get updated. So if you're interested in that information, it is at michigan.gov or MDHHS licensing. So those are available for you to review if you're interested. Definitely a few changes related to things like swimming pools, hot tubs, and there's obviously some other things that were barriers in the past that people needed for paperwork that are no longer required. So definitely, if you are interested in licensing, that might be something to review. And then lastly, we continue to work closely with the Great Start Collaborative related to our young children, 0 to 5. And we do have a contract with Samaritas called Safe Care that is available for prevention. So we continue to get the word out. A lot of people, when they think of MDHHS, they're not necessarily thinking of preventative measures when it comes to the child welfare side, but we're definitely trying to change that by providing some prevention efforts, both locally with staffing and with some of our contracts. And then lastly, if you didn't know, June is Elder Abuse Awareness Month. So I want to thank the county for allowing us to provide purple out around the county building and also with some information out in the community. So just wanted to say thank you for that. And That's all I have, I think, unless you have questions.
Thank you. Any questions? Commissioner Miedema?
Morning. Thanks for
Morning.
being here today.
Yeah.
Can you share a little bit more about the Great Start collaboration with Samaritas and what those prevention efforts might look like?
Yeah, so myself and a couple of individuals actually sat in the Great Start Collaborative itself. So get a lot of information on what's available for kids 0 to 5. But for prevention, we have a contract with Samaritas specifically to work with children 0 to 5. A lot of parent education and providing, I think there's actually a series that's provided for parenting. And then they're kind of providing referrals and information as needed. To Great Start. We have an amazing program here in Ottawa, especially with Help Me Grow. So trying to just connect those dots for families. A majority of the referrals are from our cases, either that we investigated and didn't find something or preponderance, but said, hey, because it's a voluntary resource. So there's people that might say, no, thank you. I don't want any help. That's fine. But it is something that's voluntary. So families can be referred not only from having a case with us, but if there's other families that are interested, we're able to provide that.
The Great Start collaboration, the same thing as the Great Start Readiness Program.
No, Great Start Readiness Program
I
is
know what
actually
that is.
specifically for preschool.
Okay, making sure that it was different.
Yeah.
Okay.
They're part of it though.
Okay.
Mhm.
Any other questions?
Thank you.
Thank you. Okay. Moving on, our next item is public comment. This is now our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board.
Howdy, my name is Joe Spalding. I live in Holland Township. I grew up in Park Township. And when I was growing up, I was a pretty cute kid. I know I got all hairy and weird after that, but it's fine. But you know, there are pictures of me, and I hope nobody can find them, of being about this tall, you know, off the table, dressed up as a full-on Dutch child. And, you know, wooden shoes, little hat, cute little thing. I didn't have any kissers because I was dressed like a dude. And I had to go to this parade and march through it. And I remember it hurt my feet a lot and it sucked. I didn't like it that much at the time. But every year, the community kept making me go to these festivals and these parades. And I mean, I liked the elephant ears. I thought they were okay. But, you know, as a kid, I was super impressionable. And somehow I made it out as an adult. And thank God I'm not Dutch, you know. Like, look, this grooming discussion is ridiculous. Like, you guys, you want to talk about like open danger to kids? You just voted for a resolution a few weeks ago to let people like Joe Moss carry a weapon without any type of restrictions whatsoever in our county. I mean, you can look as dumb as you want, sir. Like, that's fine. I don't care. You know, so like, if you really care about kids getting impressions, how about the impressions they get when they see an instrument of violence in public and no one gives a shit? You know, even after there's massacres in Michigan over and over again. And your concern is drag queens at a public event that parents choose to take their kids to. And by the way, aren't you all supposed to be like the champions of parents' rights? Which parents? I have gay friends with kids. Their kids deserve to see that their parents' lives are normal, that they love them and their love is valid, and that their love within their family is valid. How dare you grandstand on this nonsense, especially after that gun crap? Y'all should be ashamed of yourselves. You're pathetic. Someone should do something about it. And I mean electorally.
Thank you. Any other comments?
I'll get clapped for.
Lori Grassman, Robinson Township. I want to thank you guys for all of that questioning and being concerned. Thank you, Mrs. Miedema, for that, and the rest of you. But I guess my biggest concern, not my biggest concern, but I do have a question as a taxpayer of Ottawa County. That obviously we have paid for these vaccinations, correct? I believe in some sort of way as a taxpayer. And we bring them down to a Pride Festival. Are we sure that we're giving them to Ottawa County residents? Or are we giving them to some other residents? Because I'd at least like my taxpayer money to stay local, right? We're big about local here. So I guess I'm just kind of curious if we are serving local. Thank you.
Thank you. Any other public comments?
Hi, Gail Rollis from Allendale. Just a few comments. I was entering the auditorium this morning and I said hello to a gentleman that was sitting there. And he said, "Are you a friend or a foe?" And I just sort of looked at him like, "What do you mean?" "I am a friend. I will work with you." So that's just a point. I acknowledge what Lori had to say. My tax dollars need to stay here, not with people that are coming in from other counties, other states, whatever. But I found this yesterday, and I just wanted to leave it here with you. It is better to be divided by truth than to be united in error. It is better to speak the truth that hurts and then heals than falsehood that comforts and then kills. It is better to be hated for telling the truth than to be loved for telling a lie. It is better to stand alone with the truth than to be wrong with a multitude. It is better to ultimately succeed with the truth than temporarily succeed with a lie. Thank you, commissioners, for digging deep and for asking the tough questions and standing strong.
Thank you. Any other comments? Seeing none, as adjournment is at the call of the chair, I call this meeting adjourned.
Talent and recruitment will start at about 10:40.